Ozempic is gaining so much popularity for its weight loss effect that people are willing to risk their health and money to get it illegally. A recent report highlights how people are spending exorbitant amounts of money on fake Ozempic sold by online pharmacies with little to no regulation. The price of fake Ozempic ranges from $630 to over $1,000 per pen, which is significantly higher than the actual price of Ozempic in the United States, which is around $1,300 for a month's supply. But even at this high price point, fake Ozempic is selling like hotcakes. And there are several reasons why people are taking this risk. Ozempic, also known by its generic name semaglutide, is a medication originally developed to treat type 2 diabetes. However, doctors started noticing that their patients who took Ozempic not only had lower blood sugar levels, but also lost a significant amount of weight. This led to the drug being approved for weight loss under the brand name Wegovy in 2021. Ozempic works by mimicking a hormone called glucagon-like peptide 1, or GLP-1, which is produced in the gut and signals to your brain that you're full after eating. By activating these receptors, Ozempic has been shown to cause weight loss of up to 20% in some cases. That's why the demand for this drug is skyrocketing. But as with any popular medication, there are bound to be side effects. While most side effects of Ozempic are mild and go away on their own, there have been reports of more serious side effects, including pancreatitis, kidney failure, and thyroid cancer. Thyroid cancer is a rare type of cancer that affects the thyroid gland. It is relatively uncommon, accounting for only 1% of all cancers. However, in 2012, a study was conducted that raised concerns about a possible link between Ozempic and thyroid cancer. The study found that rats that were given high doses of a drug similar to Ozempic for 2 years had an increased risk of developing thyroid tumors. This finding raised concerns that a similar risk may exist in humans. However, it is important to note that the doses used in the study were much higher than what humans would typically receive. In 2021, Novo Nordisk, the manufacturer of Ozempic, issued a statement addressing the issue. They stated that they had conducted a thorough review of the available scientific evidence and concluded that there is no evidence that Ozempic or other GLP-1 receptor agonists increase the risk of thyroid cancer in humans. Despite this reassurance, some people remain concerned about the potential risks of Ozempic. This concern was further fueled by a lawsuit filed against Novo Nordisk in 2022, alleging that the company knew about the potential risks of Ozempic, but failed to warn patients or healthcare professionals. In response, Novo Nordisk stated that the lawsuit is without merit, and that they will vigorously defend themselves against these allegations. Despite the controversy surrounding Ozempic, it has been prescribed to millions of people worldwide. Many users have reported positive experiences with minimal side effects. However, some people have experienced more serious side effects. In 2023, the U.S. Food and Drug Administration issued a warning about the potential risk of kidney failure associated with Ozempic and other GLP-1 receptor agonists. The FDA recommends monitoring kidney function in patients taking these drugs and adjusting the dose accordingly. In addition to the FDA warning, there have been reports of Ozempic causing severe vomiting and diarrhea, leading to dehydration and electrolyte imbalances. These side effects can be so severe that some patients have required hospitalization. Despite these concerns, many people continue to take Ozempic because the benefits of weight loss outweigh the potential risks in their eyes. Now that we've covered some of the negative aspects of Ozempic, let's talk about the positive aspects of Ozempic. Ozempic is a medication that has gained a lot of attention recently for its potential weight loss benefits. Clinical trials have shown that it can help people lose a significant amount of weight, up to 20% of their body weight in some cases. For people who are struggling with obesity or are looking to lose weight, this can be a game changer. One of the best things about Ozempic is that it helps people change their eating habits. Ozempic is a glucagon-like peptide 1 receptor agonist, which means that it stimulates the release of insulin when blood sugar levels are high and suppresses the release of insulin when blood sugar levels are low. This helps regulate blood sugar levels, which can make it easier for people to resist sugary foods and snacks. Additionally, Ozempic slows down the rate at which food leaves the stomach, which can help people feel fuller for longer and reduce the desire to snack mindlessly. By reducing the feeling of hunger and increasing the feeling of fullness, Ozempic can help people make better food choices and eat less overall. This can lead to a reduction in calorie intake and ultimately weight loss. Moreover, Ozempic can also help people become more physically active. Weight loss medications are often stigmatized, and many people are reluctant to take them due to concerns about potential side effects or societal perceptions. However, the stigma surrounding weight loss medications may be fading as more people become open to trying new approaches to weight management. Ozempic is a relatively new medication, and it is still not widely understood by the public. As more people learn about it and its potential benefits, it may become more accepted as a tool for weight loss. We've talked a lot about the pros and cons of Ozempic, but now it's time to look at the science behind how it really works. So let's get into it. Ozempic is a medication that has been shown to have some impressive weight loss benefits. But what makes it so effective? Let us take a deep dive into the science behind how Ozempic works and the studies that support its efficacy. One of the primary ways that Ozempic works is by mimicking a hormone called leptin, which is produced in the gut and signals to your brain that you're full. When leptin levels are high, your brain receives the message that you're full and satisfied, which can lead to a reduced appetite and ultimately weight loss. Studies have shown that Ozempic is able to bind to the same receptors in the brain that leptin does, effectively tricking your brain into thinking you're full even if you haven't eaten a lot. This can lead to a decrease in calorie intake and ultimately weight loss. Another way that Ozempic works is by slowing down the rate at which food leaves your stomach. This is known as gastric emptying, and it's a key factor in how quickly you feel hungry after a meal. When food leaves your stomach more slowly, you feel fuller for longer and are less likely to snack or eat large meals. Studies have shown that Ozempic can slow down gastric emptying by as much as 50%, which can lead to a feeling of fullness that lasts for hours. This can be especially helpful for people who tend to snack mindlessly or eat out of boredom. It's important to note that while these studies show promising results, it's essential to consult with a healthcare professional before starting any new weight loss medication. They can help you determine if Ozempic is right for you based on your individual needs and medical history. While Ozempic has been shown to be effective for weight loss, it's important to remember that it's not a magic bullet. To see the best results, you need to combine it with lifestyle changes such as a healthy diet and regular exercise. Additionally, it's important to be aware of the potential side effects of Ozempic, which can include nausea, vomiting, diarrhea, and constipation. While these side effects are usually mild and go away on their own, they can be severe in some cases. If you want to try Ozempic for weight loss, talk to your healthcare professional about whether it's right for you. They can help you weigh the risks and benefits and determine if it's a good fit for your weight loss goals. With that said, it's also important to explore other options for weight loss, such as lifestyle changes and other medications. There is no one-size-fits-all approach to weight loss, and what works for one person may not work for another. So it's essential to try different things and find what works best for you. As the demand for Ozempic continues to grow, it's important to be cautious of scams and fake products. Make sure to only buy Ozempic from reputable sources and be wary of products that seem too good to be true. Don't risk your health and money by buying fake Ozempic from online pharmacies. Overall, Ozempic is a powerful tool for weight loss that can help people achieve their goals and improve their health. But it's important to understand how it works. Be aware of the potential side effects, and use it in conjunction with a healthy lifestyle. Do you fall for scams or fake products, and always consult with a healthcare professional before starting any new medication. If you're struggling with weight loss, don't hesitate to reach out to a healthcare provider. They can help you develop a plan that works for you and support you on your weight loss journey. Remember, sustainable weight loss takes time and effort, but with the right mindset and support, you can achieve your goals and improve your overall health. Thank you for watching our video today. We hope you learned something new and found it helpful. Please like and share if you enjoyed it, and stay tuned for more informative content. If you have any questions or comments, please drop them below. We'd love to hear from you. Have a wonderful day, and take care.